My name is Lance Kuhlmann, physical therapist for Midwest Physical Therapy and director of the North Clinic location in Lincoln, Nebraska. Today I'd like to speak to you briefly about plantar fasciitis. Plantar fasciitis is a painful inflammatory condition affecting the plantar fascia on the bottom of your foot. The plantar fascia is the connective tissue that attaches at the heel and runs along the sole of your foot, comprising most of the arch. Occasionally, people affected with plantar fasciitis will have a heel spur. However, heel spurs do not cause plantar fasciitis and are not always present in people with plantar fasciitis. Plantar fasciitis occurs over time with microscopic tears due to excessive weight bearing, changes in activity levels, or faulty foot structures such as a flat arch or a high arch, or a tight Achilles tendon complex. The Achilles tendon attaches to the heel, and on it attaches the gastrocsoleus complex or the calf muscles of the lower leg. Plantar fasciitis is most commonly identified by a common subjective patient complaint. The patient will oftentimes come to the clinic and say, "My foot hurts worse in the morning when I first get out of bed." Typically, it is diagnosed by the patient's subjective history and an objective exam by the healthcare professionals such as a physician or physical therapist. This objective exam will include range of motion assessment, assessing the flexibility of the gastroc and soleus complex or the calf musculature, as well as strength within the ankle and the foot, doing a gait and postural analysis, as well as palpating the affected structures. What can we do at Midwest Physical Therapy to address your plantar fasciitis symptoms? First and foremost is addressing activity modification. By addressing activity modification with the patient or modifying the activities that the patient is involved in, we are addressing the root of the cause of the symptoms. Activity modification may include a different training regimen if you are a distance runner, or changing the amount of time that you are on your feet at work. Secondly, we would address these symptoms and decrease the inflammation through a variety of things within our clinic. Modalities such as ultrasound, iontophoresis, or ice massage can be very effective, along with over-the-counter anti-inflammatories to address the patient's inflammation. Other treatment options for plantar fasciitis include fitting a patient with custom-made orthotics. Custom-made orthotics will provide the patient with adequate arch support to assist or take the load off the plantar fascia and position the foot more correctly. Proper shoe wear is also important, especially for those who are frequent runners. Oftentimes we'll educate the patient in proper shoe wear to make sure that they are fitted with the proper shoe to support their foot when running. When looking at a shoe, I oftentimes tell a patient to look at a squeeze test with the shoe, to do a bend test, and to do a twist test with the shoe. We want to make sure that the bend is occurring just at underneath the metatarsal heads or just at the ball of the foot. Also, when we're looking at a twist test, I want to make sure that it's not twisting across the entirety of the shoe and that the arch is rigid and supporting the foot and not collapsing when a twist or a torsion force is applied to it. Also, a squeeze test, I'll simply squeeze the heel counter in the back of the shoe to make sure that the heel counter is good and stiff, to provide the heel with some adequate control and prevent any rear foot instabilities. Other effective means of treating plantar fasciitis include stretching the gastrocsoleus complex or the calf musculature and the heel cord. Resting night splint will also provide a low load, long duration stretch on the heel cord. We want to stretch that heel cord at a low level, but over a significant period of time. If you or someone you know is suffering from plantar fasciitis, see your healthcare professional. Ask your physician to refer you to Midwest Physical Therapy. We'll be happy to assist you getting back to the activities you enjoy most. If you have any questions, please contact Midwest Physical Therapy at 402-436-2535. Thank you and have a great day.